Okay, I'll wait a moment. Thank you. How are we doing, Katie?
I have quorum, so I would go ahead and get started.
All righty. All right, well, hello, everybody. Good afternoon. Thank you so much for joining us today. I know we're waiting for a couple other members, so hopefully they'll join us very soon, but thanks to everyone who is here now. So with a quorum present, the Maricopa Regional Continuum of Care Board is now called to order. Please remember to mute when you are not speaking. Board members, please do not use the chat function as the audience watching cannot see it. Before we get started, I wanted to welcome Rachel Milne from Maricopa County. Welcome, Rachel. We're super excited to have you on board. And also a shout out to our new co-chair, Rob. Hi, Rob. They're trying to figure out what block you're in. I see you. There you are. And Rob.
Unpixelated one.
There, that one's so much better. Thank you. And Rob will be chairing our next meeting in April. So welcome aboard, Rob. I'm now going to ask Katie to proceed with the roll call. Please indicate you are here and the organization that you are with after Katie calls your name.
Tish Brown Gambino.
Here, Letitia Brown Gambino, UMOM.
Jacqueline Campbell.
Here, U.S. Vets.
Eric Cole. Liz DaCosta. Marshall Franklin. Todd Gary.
Todd Gary here with Mercy Care.
Lisa Glow. Chris Howlett.
Present.
Chris is with Peoria. Rachel Milne.
Present, Maricopa County.
Thank you. Rob Podlager.
Rob Podlager, Valley of the Sun United Way.
Joan Service.
Joan Service, Arizona Housing Coalition.
Charles Sullivan.
Hi, Charles Sullivan, Arizona Behavioral Health Corporation.
Jackie Taylor.
Present, Save the Family.
Danielle Wright.
Present, Danielle Wright, Arizona Coalition to End Sexual and Domestic Violence.
Co-chair Ryan Balch.
Here, City of Chandler. All right, thanks everyone.
We did just have Eric join us. Eric
Oh,
Cole.
great. Eric? All right, well, Eric Cole is here, ASU. Okay. The next item on the agenda is a call to the audience. Members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov/comment within an hour of the posted start time for the meeting, or can join the Zoom meeting by requesting the link from MAG staff or registering on the COC board meeting event page. If you are wishing to make a comment, please raise your hand in Zoom and you will be invited to unmute at that time. Public comments are limited to 3 minutes. We have a lot of really interesting stuff on our agenda today. So public, I hope that you will join in if you have questions or comments. We really want to hear from you. MAG staff, were there any comments received or anyone who has joined the call to offer comments at this time?
Madam Chair, no comments were received and no one in the audience has raised their hand at this time.
All right, thank you so much. Let us know if that changes. Our next item is the approval of the February 28th, 2022 meeting minutes. Does any member of the board have questions or comments on the minutes? Okay, seeing and hearing none, could I have a motion to approve the February 28th, 2022 Maricopa Regional Continuum of Care Board meeting minutes?
So motioned. Tad Gary here.
Thank you, Tad. Can I get a second?
Chris Hallett?
Chris, was that you?
Yes.
Yes, okay, so we have a first from Tad and a second from Chris. Thank you so much. Is there any discussion? All right, hearing and seeing none, I will ask Katie to please proceed with the roll call vote. Please remember to state yay or nay after your name is called.
Tish Brown Gambino,
Yay.
Jacqueline Campbell. Jacqueline, you're on mute.
Yay.
Thank you. Eric Cole,
Yay.
Liz DaCosta, Marshall Franklin, Tad Gary,
Yay.
Lisa Glow, Chris Hallett,
Yay.
Rachel Milne,
Yay.
Joan Service,
Yay.
Charles Sullivan,
Yay.
Jackie Taylor,
Yay.
Danielle Wright,
Yay.
Co-Chair Ryan Balch,
Yay.
Rob Podlager.
Yay.
You, the motion passes unanimously. Back to you, Chair.
Thank you so much, Katie. All right, moving on. The next agenda item is updates. Chairs of committees with recent activity will be asked to share with us. Updates will also be provided in the monthly newsletter sent out by MAG. I hope everyone's getting that. I was so happy to see that again. It is so chock-packed of amazing information. So I hope everyone's getting that and enjoying it. So let's go to updates. First, we're going to hear from Board Member Joan Service with a legislative update. Joan?
Hi, good afternoon, everybody. Continue to be a busy week at the state legislature. Last week, we had in committee the bill, Senate Bill 1581, as it relates to sanctioned campsites. And I want to give a special thanks to two individuals who testified and two other individuals who came down and wanted to testify. We just had to limit it to 3 people. So huge thanks to Trevor Southwick and Richard Cruz. And then also a hat tip to Maxine Becker from Wildfire and Margaret Adams from the Corporation for Supportive Housing. The bill, as expected, did pass House appropriations. Again, this is the piece of legislation that would allow for sanctioned camping sites. However, it was amended to remove the requirement of cities and towns to enforce the camping ban so long as cities and towns show upon application to ADOH, a decrease of 80% of the unsheltered population. So all they have to do is basically say that they're going to decrease the unsheltered population by 80%, because again, this is one-time funding. And so there's really kind of unclear as to what kind of clawback provisions, et cetera, exist in this bill that has been amended so many times that it's a little confusing to figure it out. So all that being said, this is a win in the sense that they have removed the requirement for cities and towns to enforce the camping ban, which we know as a community, as a sector, we're concerned about, our local jurisdictions are concerned about because of constitutionality concerns. And an additional kind of win would be that some of the language has changed, that there's no longer a heavy law enforcement mandate to make up these homeless outreach teams. It's now instead, A or B kind of situation. And to that point, crisis intervention trained law enforcement that know how to engage folks living on the streets is something we would advocate as a community for. So anyways, that bill, Senate Bill 1581, did pass House Appropriations. We at the Housing Coalition respectfully opposed it. However, we continue to work with Senator Livingston, who's the bill sponsor, and the proponents of the bill, Cicero Institute, because if you remember, Senator Livingston has kind of brokered a deal where all of these housing and homelessness bills work together. We're hoping that it can be further amended to include, to kind of, again, decrease and actually lift up plans like our regional plan to end homelessness as how you can, how cities and towns can tap into the $30 million of ARPA dollars. All that being said, the governor's office hasn't weighed in on if they're going to allow that to be an allowable utilization of the ARPA dollars. So again, work in progress, but I did want to call to everyone's attention House Bill 2528. It is a striker, and it is going to be heard tomorrow in Senate Appropriations. Well, Senate Appropriations has basically extended their agenda to both tomorrow and Thursday, but we believe it'll be heard Tuesday. House Bill 2528, it's a striker that says Housing Trust Fund federal monies. This is Senator Livingston living up to his commitment of ensuring that Senator Alston's bill, which appropriates $100 million of ARPA dollars to the Housing Trust Fund, this is what that bill does. And so we ask, if you have a request to speak account at the state legislature, to go ahead and sign in and say that you support House Bill 2528, the striker, again, which appropriates $100 million to the Housing Trust Fund. And happy to answer any other questions y'all might have.
Well, if there are no questions, Joan, I just want to say thank you so much for your leadership on these bills. It's been a lot. Having been involved with one of them, just been a lot of meetings, a lot of negotiations, a lot of discussion. I think a ton of great progress has been made that would not have been made without your leadership. So thank you so much on that, and appreciate you keeping up, following these and keeping everybody up to date. Thank you very, very much.
You guys are informing it all, so thank you so much.
Any other questions or comments for Joan before we move on to the next update? All right, seeing and hearing none. Thank you again, Joan. Next, we will hear from Wendy Johnson with the Justice Center for an update from the Continuum of Care Committee. Wendy.
Good afternoon, and thank you for allowing me to give a verbal update today. Richard Cruz from the Human Services Campus and I co-chair the committee. One of the things we wanted to do was to improve the connectivity of the individual members of the committee and raise their awareness and their engagement in processes. We have just finished our third meeting, and we have folks really engaged in data, in outcomes, in doing those things. And we're looking forward to some strategic planning coming down from you guys so that we can then empower it with boots on the ground. We are amazed at the amount of dialogue that's happening and the support we're getting from MAG. It's great.
Thank you so much, Wendy. That's really exciting. That's just exactly what the board is hoping for, is engagement at the committee levels, because that's where all the work is happening. So thank you so much. Other board members, comments, questions? All right, keep up the good work, Wendy and Richard and all of the members of the committee. I know that's a big one, and I know you guys have really fruitful discussions. I'd like to actually come attend one of these days. That would be great. So I'm sorry, I was just distracted. Next, we are going to hear from Matthew Kelly with Mercy Care and Jasani Goodman with Phoenix Rescue Mission for an update on the Coordinated Entry Subcommittee.
Good afternoon. Just wanted to provide an update of some of the work that is happening in the subcommittee. So the first update is our domestic violence work group met earlier in the month of March, and we're basically working on addressing access and trying to have conversations with other DV providers in regards to that. We had some of our coordinated entry leads meet with DV providers to provide some information on the coordinated entry process. And we're hoping to start addressing the prioritization element next in trying to advance that conversation. So far, it's been really exciting, a lot of collaboration, a lot of conversation, a meaningful conversation happening amongst the partners to help in trying to streamline that and trying to see what we can do to make sure that individuals that are experiencing domestic violence or survivors are connected to much needed resources. The next update is basically an ongoing conversation on the core elements of coordinated entry. This was some work that was started with MAG, and now we're working together to try to address a couple of areas that need further exploration within the core elements. So addressing access, prioritization, referral, and just trying to identify where are some areas that our subcommittee can focus in on and try to see if there's areas of opportunities within that. And then the last update is our homeless prevention work group. We're right now in the final stages of being able to successfully have a coordinated entry process for that. And we've been working with the coordinated entry leads and Solari on that as well to try to create a coordinated effort for that.
Thank you, Jasani.
Thank you.
Comments, questions from the board?
I just have one question. Sonny, how many providers do you have in the DV work group? How many are engaged at this point in time?
Yes, Matthew, do you have, maybe you can help me with that question?
Sure. So there's a work group that's being run out of coordinated entry, Letitia, that has probably, I believe, 5 or 6 different providers that are participating in that. As part of some of the additional work that's being done is there was a program managers meeting where actually both coordinated entry leads went and presented on the coordinated entry process to those program managers. And then I think I also want to thank Danielle and Dana, who are kind of taking a proposed plan for some data sharing between the coordinated entry system and the DV system and trying to bring that all together. So there's a lot of engagement and involvement across the DV provider community because clearly we need them to be on board and in agreement with what's the process is going to be. So
thank you, Matthew.
Mm-hmm.
I would just ask at some point we get the board get an update also on the eviction prevention, what that's turning out to look like. I'm really excited to hear and learn more about that.
For sure, sounds good. Yeah, we can definitely work on that. Thank you.
Okay, thanks so much. Any other comments, questions? Thank you guys for joining us. We really appreciate all your work. All right. And last, we're going to hear from Katie with an update from the Race and Equity Group.
Thanks, Co-Chair Balch. Nikki provided me with an update. She's unfortunately unable to come today. The racial equity team is working on a toolkit to assist organizations on next steps to internally address the overrepresentation of BIPOC in the homeless response system. So our race equity plan is system-wide. Solari developed out the art report to be focused on data. So this would work hand in hand with the art report for what organizations individually can do to address racial equity. We again are having race equity partners providing consultation to us as we're working through that and the creation of the toolkit.
Fantastic. Another exciting thing that I'm glad something very tangible is coming up on board for providers. I can't wait to see that. Any comments, questions from the board? You guys are a quiet bunch today. All right. All right. Thank you, Katie. I will move on. So at this point, is there any other board discussion or questions about anything related to committees or things you want to see upcoming before we move out of committee reports? All right, then thank you very much, committees. Don't forget everybody out there to take a look at the newsletter for updates. So next we are going to learn a little bit about the 2021 system performance measures. And Stephanie Crum, HMIS Manager with Solari Crisis and Human Services, will present our 2021 measures that were submitted to HUD in February. Stephanie.
Hello. Thank you,
Hello.
Madam. Hello. Thank you, Madam Chair and members of the board. It is quiet today. Hopefully the little data conversation will spice things up here. All right. So we're going to be talking about our system performance measures, which will lead into our Nofo discussion, I think, right after this too. So as we're talking about our system performance measures, we are looking at the submission period of October 1, 2020 through September 30th of 2021. So all this data we're looking at is a snapshot from this time period. All right. Move to the next one. All right. So let's talk a little bit about what the system performance measures are real quick, and then what the federal framework looks like around that. So when we're talking about our system and its performance, we want the clients in our system's experience of homelessness to be rare, brief, and non-recurring. And how we look at that and how we measure those is we look at the number of persons in our system, the number of new persons coming into our system. We look at the length of time that they're spending in our system when we're looking at the brief component of that. For non-recurring, we're looking at the percent of returns in our system, as well as like positive exits to housing destinations out of our system. And then another thing we look at to measure this framework is job and income growth. So we're going to look at increased income, both earned income and other non-earned income as well. So that's kind of the framework that we're looking at. That's what we're measuring here when we're talking about our system performance measures. And these are our goals. We want the experience of homelessness to be rare, brief, and non-recurring. Next, please. And then when we're talking about how the system performance measures relate to the Nofo, which is our notice of funding opportunities, which will be the next agenda item, this really does tie into Nofo scoring. If you look at how the points break down in the percentage that it ranks on the scorecard, the system performance and the COC's performance and strategic planning really do make up about half the scorecard. So these system performance measures are really important to look at, and they're also a really great starting point for your strategic planning across the COC. All right, so let's get into the numbers. So our first measure that we're looking at here is first-time homeless. We're looking at the total number of clients across the system here who entered a homeless project without any prior homeless entry in the past 24 months. And the program types that we look at are emergency shelter, transitional housing, and safe haven. You can see here that we did have quite a significant increase from 2020 system performance measures to 2021. The desired trend obviously would be to lower that number, but we are trending up for 2021. Move to the next measure.
Stephanie,
yes.
Yeah, this is Tad Gary, just back on that. So how do we, and I don't know if this is as a board or with how you guys are kind of looking at these numbers, but obviously we know the population has grown to just the wide, like not even thinking of, necessary homelessness first and foremost, but just the population of Maricopa County has grown. So how does that play into how we're messaging too? Obviously we want to, I don't want to overshadow the fact that our homelessness numbers have gone up, but our population has gone up as well. So when we think about rare and how we kind of define where, I would think that would be something we would be looking at with these numbers as well to help explain some of what we might be seeing. But I'm just curious how we consider that.
Yeah, definitely. I think a lot of the messaging we can talk through with MAG and the COC. Definitely with these increases, when we looked at the measures for first-time homeless, a lot of this is being driven by your heat relief shelters in the summertime, the short-term shelters, night-by-night shelters, and also COVID relief, high-risk shelters as well. So that was a significant factor in this increase. So that could be, that's part of the story, telling the story of what this increase means. Is just something that we'll have to look at system-wide.
And is that like, and maybe this is for MAG too, and maybe even Ryan, like how when we go up to HUD and we're, because we're having to compete for some of the dollars too, or is that part of the messaging that we're sending to, just as the growth in population, and even though these numbers have gone up, so has kind of some other drivers that aren't necessarily related to homelessness per se. I see Ryan shaking her head, so.
Yeah, and Katie can actually speak to the narrative that was written in the application. So, but yes, Katie.
Yeah, actually so all these system performance measures were just turned in last month. So we will be addressing these in the 2022 Nofo, which is the next item on your agenda, talking about how do we talk about this in the consolidated application. So it is a measure of, like, I would say HUD measures, like, did we hit the mark or not, as far as what the desired trend is versus the actual trend. But there is places to, like, describe why is this happening. So everything that Stephanie is commenting on would be included in our narrative portion of that. And also we have, like, data around how many additional shelters were open, how many additional places were people, like, sheltering because of heat relief or because of COVID. Even our sheltered point in time count, which hasn't been released yet, but will be released soon, was an increase from 2021 and 2020 because we were seeing additional people sheltering inside instead of out. Does that make sense?
Yeah, thank you, Katie. I figured as much. Thanks.
And I think part of it too is going to be going all the way back to 2020, Tad, with that number going down from 2019 is also needs some explanation, because you'll recall that we also had to social distance within our shelters. So we actually lost shelter beds during that year. So that was the reduction perhaps wasn't real. It just appears less because, so we're just continuing to trend, as our point in time count shows about 18% per year. And that's the upward trend that we're on at the moment.
This is Rob, if I can interject. Ted, I like where you're going with that, and it would be probably interesting to get a longer trend, even maybe back prior to 18, based on when we have information around the overall population growth in general. So I think just having a clear picture to understand from whichever angle we're able to, to be able to see that. So everything stated makes sense, but it's definitely we see more and more people coming into the valley. So I want to make sure that we have our eyes on that number also.
Back to you, Stephanie.
All right, let's take to the next one, the next measure here, which is the length of time in shelter. So again, we're looking at across the system, the average amount of days that a client will spend in our shelter systems. So we're looking at, again, emergency shelter, transitional housing, and safe haven. And our desired trend is to reduce that length of time. And we are still trending down. 2020 was 103 days. And for 2021, we're looking at 102 days. So a reduction of 1. And then housing exits from shelter system performance. What we're looking at here, again, is across the system, the percentage of housing exits to a permanent housing destination. So we're looking at exits from emergency shelter, transitional housing, and again, from safe haven. We did see a downward trend for 2021, a reduction of 8% off of 2020. So yes, there's a desired trend going down that way.
Can I stop and make a comment, Stephanie?
Sure.
You could actually go back to the last slide. So I think as a board, this is something that we're going to need to prepare to talk about and influence is, you're seeing in this slide, the trend going down slightly in 2021, but we know that it's going, I bet in this year, that's really last year, in the year that we're in now, it's going to go up because of the inability to place people because of the supply and demand, issue with housing. So we're going to see this trend go up. And then Stephanie, the next slide, along with it, this is going to go down because people are going to have to stay in shelter longer and they're going to have less exit to housing. So I think, we're all on board and working very hard to influence that moving forward. But I think this next year is going to be a tough one in terms of how the system's performance measures come out. And we're going to need to be prepared to, talk about everything that we have moving forward. And so for those of you who have contributed, at least municipalities at play are right now, everybody's writing up, what we are contributing to the regional plan, and all of that information is going to, be very necessary moving forward as to how we're going to flip this trend. So just trying to provide a little bit of context for what's coming.
So this is Jackie, and I couldn't agree with you more. We are finding our families languishing longer in transitional, trying to find a place that's affordable once they get out. We're also finding families lingering in the search mode, trying to find an affordable unit that they can afford with our rapid rehousing assistance dollars. It is a very, very tough market out there. And golly, it's honestly hard to see light at the end of the tunnel short of creating more affordable housing that we can access.
All right, back to you, Stephanie. Thank you.
Yeah, absolutely. Thank you. I think that is definitely correct, that it's a reflection of what's happening, in our community. For our next performance measure here, returns to homelessness, we're looking at system-wide the return of clients who exited from housing and then returned to a homelessness program within 365 days. So we're looking at any permanent housing program exit, and then we're looking at any return into any homelessness program type. So we're still just right on track with our trend from last year, sitting right about 18% returns from homelessness. So we didn't really budge one way or another, but we are still right on target there.
Stephanie, this is Kelly Williams with MAG. Can I ask a question about that last slide?
Absolutely.
Is that an 18% return to homelessness within our continuum, or are we looking at HMIS data across other areas in either Arizona or?
No, this is across our continuum.
Okay, thank you.
Yes.
And on that note, Stephanie, or maybe Katie, is there a national benchmark that HUD would like us to meet there?
Better than last year, but obviously we want to just keep trending down. The Stephanie, I don't know if you know what the ultimate goal of HUD is, but we've never gotten close to it.
I want to say, I want to say that it might have been a reduction of, I'd have to look. I want to say it's reduced, like a 5% reduction.
Yeah, I want to say 5% also. So
Yeah.
ideally you would have less than 5% returns to homelessness.
Oh,
But
wow.
the trend would be that you continue to drive down towards that.
Mhm.
HUD doesn't expect you to go from 20 to 5. They just expect you to try to get closer.
But the ultimate goal is 5-ish? Okay.
I believe so, yes. Okay. All right, our next measure is job and earned income growth. We're looking at an aggregate percentage here of the clients across our continuum who and clients across continuum projects only who had an increase in income. And we were looking at a lot of different project types here, homeless prevention, transitional housing, safe haven, rapid, PSH, permanent housing, and then permanent housing with other services. So we did see a downward trend here. And again, I think that this is reflective of what's going on, economically across the country. And again, I think a story can be told there as far as that goes. I do want to jump, I'll take questions on this, but I do want to jump to the next slide because I think that helps ease the pain of this slide a little bit. If we jump to our non-earned income growth, you want to jump to the next one, Katie? Sorry. If you look at our non-employment income, we had quite a large increase here, which is really great. And I think that this speaks to a lot of the, disability benefits, a lot of other benefits that were being applied for during this time. And we saw that quite a big jump here. And again, we're looking at our aggregate percent of clients across the continuum who increased their non-employment income. So this was quite a big jump from 2020 to 2021. So even though our job and earned income growth trended down, we definitely trended up in our non-employment income. So I think that too can be just reflective, of what's happening with COVID and with a lot of businesses shuttering and reduction of hours and just it was hard. It was a hard year for jobs and earned income, I think, all around. But did anyone have any questions on income, whether it be non-employment or jobs and earned income?
Hi, this is Letitia from UMOM. I have a question about the non-employment income.
Mm-hmm.
I think one of the drivers for that increase, does it also include some of the COVID stimulus and the other tax credits, like the child tax credit? Was that included in that number?
I believe that these are based on not like temporary, not like a temporary income. I think Katie could speak a little bit more to that, but this would be a permanent income.
Permanent income, thank you.
Mm-hmm.
Yeah, all of that COVID stimulus was one-time money and it was excused from income. The one caveat I have on that is tax credit for children. I don't know because that is an ongoing. I don't believe it is included, but I would like to double check on that.
Thank you, Katie.
Okay, and then moving on, that brings us to the end of our measures, but I do want to talk about what all this means and the opportunity that this has. There's plenty of opportunity we have here in the COC to impact these system performance measures. And when we're talking about rare, brief, and non-recurring, you can really look at in your strategic planning, targeting your continuum of care funding in these areas. So if we're talking about rare, we really want to strengthen our diversion, prevent folks from entering the shelter system in the first place if they have alternatives and just need a way to get there. If we're leveraging our existing prevention, I know we have a lot of HP dollars out there right now. How are we targeting that with folks? When we're talking about making the experience brief, are we increasing our rapid rehousing dollars? Are we targeting these long-term stayers? Who are they? Why are they getting hung up here? What are their barriers? Something to look at. When we're looking at making the experience non-recurring, we can look at move-on strategies, progressive engagement. Those folks that might not be able to sustain their housing in rapid, are we really making sure that they're not falling back to the streets? Those are just some ideas for some of these areas to target funding. Job and income growth, we saw great non-earned income growth there, but with jobs and earned income, what existing partnerships do we already have? You know, we have DES at the table, you know, vocational rehab. There's just tons of programs that are already at our table. How can we improve those partnerships and help the jobs and earned income growth stabilize, much like the non-earned income has improved and stabilized. So these are just plenty of opportunity here at the COC and your strategic planning to really look at this and fold it into your plan. And I think that brings me to the end. If you have any questions at all regarding this, please don't hesitate to reach out to me at stephanie.crom@solari-inc.org. And of course, for any HMIS general stuff, you can reach us at hmis-support@solari-inc.org. Thank you very much, Madam Chair and members of the board.
Thank you so much, Stephanie. Great presentation. It's really good to see those numbers and hear them explained so simply for us. Board or audience, any questions? And I know we are as a board, we've been diving into these system performance measures because we are also using them as a framework in our strategic planning. So that there'll be more on that coming forward. So thank you again. Find my notes. All right, moving on to the next item. On March 14th, HUD announced the 2021 Nofo Awards. So Katie is here to provide us an overview of the awards and discuss the 2022 Nofo process, because we have to get started on that right away. So we'll talk about the process, the timeline, and next steps on that. So Katie.
Thank you, Madam Chair, members of the board. Wanted to first jump into, you all should have received a press release from us. If you didn't, please let me know. But March 14th, as Ryan mentioned, we did have an announcement of our HUD Award. It was just over $35.7 million. We funded 32 programs. So that was 28 housing projects, 2 coordinated entry, HMIS, and planning. I know some of our board members specifically asked, like, what does that mean? So 2 new projects were approved, plus an HMIS expansion. So 2 new housing projects, I should say. Community Bridges that had a PSH 37 expansion, and then Chicanos por la Causa had a DV bonus project funded. So total in our system, that's approximately 2,141 existing beds and 57 new beds. I say approximately because we do have people kind of moving in and out. Sometimes we end up serving greater than just what folks put in as their submission. And then in addition, we did expand our infrastructure for an additional $220,000 that went towards HMIS. I'm going to pause on that and see if there's any questions before we jump into 2022 and that process and timeline. Awesome. So 2022 Nofo, we are kicking it off once again. HUD has already opened up the first kind of big step of the Nofo, which is having COCs register saying they plan to apply in 2022. We've done that, but then we kind of start the ball rolling as far as what is next. Typically, we see that, I will jump to timeline and then come back. We typically see that the Nofo is released sometime in June and July. And so this timeline is really looking at how do we get, what are the stuff we need to do before the Nofo is released and then after until we submit. I say typically because last year it was not released until the end of August. And so our submission wasn't until the end of November. And so everything kind of shifted back. We are, the Nofo is typically for signing up as a COC saying that you're intending to submit is in January. That didn't actually happen until March of this year. So we may see a delay again this year, although we are moving forward as if anticipating a summer open. So what are we doing right now? In March through April right now, some of you may have seen the invitation for it. We had a work group that specifically reviewed the scorecard, and now at your next meeting and at the committee meeting in April, we will be approving that any changes to that scorecard. In May, we will start the application process for local applicants who are interested in renewing or applying new. Applicants will submit their documents, we'll be reviewing those scores, and then the applicants will review those scores based off the automated from the scorecard. In the beginning of June, July is when we will finalize that, and then we will also have the Nofo kickoff. So that will really be kind of the start of our once HUD has released the Nofo, we will start digging in and talking with applicants about any changes to the Nofo. In July and August, our team will be kind of running all hands on deck to complete the consolidated application. We will have a review and rank meetings, reviewing those applications, and then we will prepare the priority list for you all to review. And then finally, in September-ish timeframe, the board is going to approve the application and we'll submit the application to HUD. So how do we go through this process? So each year you all have a deemed process called the review, rank, and reallocation process. It's a review of how you all decide to score applications. It includes the scoring materials, how you review applications, an emergency procedure if something were to happen, and then also an appeals process. This is something that you all just approved in April 2021, and we will continue to follow that. You review it each year with your charter. So next steps as to now that you've kind of seen this process, next month we will be approving the Nofo scorecard with you all. Starting in May, we will contact applicants for renewals and new applications if anybody is interested. We'll be scoring applications and applicants will be submitting supplemental materials and written responses to us. And then happy to answer any questions or talking about kind of that process.
Yeah, Katie, this is Tad again. Just a quick question. I apologize if you had sent this, you probably did maybe. So for HUD and their application, because they score us, right, too. And so just off the cut, has there been do we have the new scoring that they're using for this or not, for this kind of next application?
So it's kind of a two-step process. We score all of our applications internal or like locally, and then we submit those to HUD. And then the consolidated application, which is what MAG prepares, is 200 points. As Stephanie mentioned, 100 of those points are based off of our system performance measures and how we're doing. That's what's getting released in early July is usually the time frame of it being released. And they will not only release all of the questions, but how they are scoring those questions.
Okay, so it'll still be a kind of, we won't see that as we're kind of signing off on the scoring. We won't have seen what HUD is planning to do.
So that the Nofo scorecard that you all are looking at is only for our local. So HUD basically says, locally, you need to decide how you're prioritizing from top to bottom. We don't, based on how we do on the consolidated application is who they decide to fund based off of our tier 1 and tier 2 funding. The one like kind of like I put a caveat on it. Last year, for example, they gave bonus points on our consolidated application if people were specifically working with healthcare partnerships or with housing partnerships. And so in our application, our local application, if for new projects, we added an interview question that gave points asking that, which doesn't come until after the Nofo's released.
Okay, and that's kind of what I was getting at, was trying to see if there was a little bit of change. I remember that from last year, and if there was any changes with that gave us a little bit better kind of sight or kind of crystal ball into what that might be, but our wish did not come true on that. So, okay, thanks.
Any other questions?
Katie, do we know yet how we performed nationally?
No, we do not. Once we relatively speaking, we have heard kind of not a ton of tier 2 got funded, and most of CBI's PSH was in tier 2. So that's exciting for us. We heard that the DV bonus projects were typically funded more than tier 2 was. So don't know if that's because it was in tier 1 and tier 2, or kind of what was the reasoning for that. We should hopefully receive kind of our scoring in the next month or so. Is kind of typical about a month and a half after the awards are released.
But super exciting, not, don't know how we compared, but we actually did very well. And we brought on 2 significant projects that will now go into our baseline. So this is really exciting news. Congratulations to those applicants and to our whole community, really, for everything that happens as part of this application. And the application is very much based on our performance as a whole community. So kudos to everybody for, putting us all in a position where we can be awarded and accept 2 fantastic new projects. So really excited about that. Thank you everyone who put in all the hard work, from the applicants to the reviewers to MAG staff who had to write the dang thing. Well done. Very well done. Any other questions on that? So I'm trying to juggle my screens here so I can see you all. Okay, don't see anything. All right, thank you so much, Katie. All right, so since Katie just went over the process for next year, which is, one ends and the next begins. So we have some options in terms of whether we want to form a work group now to determine our strategic priorities as a board as we go into this season. So we can elect to do that now, and I would be asking for volunteers. The other option is we are this close to being done with our strategic plan. And if you'd like to wait until we're done with that to inform how we'd like to strategize for the Nofo, we can also do that and form a work group at that time. So any thoughts from the board?
Ryan, can I add a little context?
Yes, please.
This work group is specifically because our rank and review subcommittee would come to you and say, what are the board's priorities? And in the past, the priorities have been like, we want to do only fund renewal, or like our first priority is renewals, or kind of whatever that is. It's really helpful for the rank and review subcommittee to be in alignment with whatever you all choose. How our 3, the rank and review subcommittee will present to you 3 different options when they come to you to get approval. The first one is just going to be a complete blind score based off of submissions from the applicants. The second one is going to be the blind score plus discretionary points awarded by the rank and review subcommittee. And then the third one is going to be blind score plus discretionary points, but in context of the board's priorities. And so that's really helpful to have them determine how that third one is ranked and what falls into tier 1 versus tier 2.
Okay, so feedback from the board, knowing that, putting a small subcommittee now to discuss the options, or waiting till we're done with our strategic planning, which we hope to be done about sometime in April, to put that group together.
So this is Jackie. I think it would make sense to get through our strategic planning process and then bring that group together based on what the priorities are that are fleshed out in the plan.
Okay, thank you, Jackie. Other thoughts? I know some of you have been on the rank and review committee in the past. If you have any feedback from that perspective.
I've been on rank and review a few years now, and that having that direction from the board is like so important. We didn't necessarily have it last year, so we used the direction from the board like 3 years ago, and so I would just highly recommend we have that. I've been to one strategic planning session so far, so I'm fine with waiting, but I would really like to be a part of that subcommittee if possible, just to utilize my experience on rank and review and how that went. I think that would be.
That'd be fantastic, Rachel. I love having that perspective.
And I'd like to offer, I'd like to be a bit on that committee as well. I'm not sure I'll be at the last strategic planning, so if you're going to pick them then, I want to register now that I'm interested. I was also, and I thank you for the last presentation where you say how many new beds, because one of the learning experiences for me being new on the board is you always heard as an outsider all this money that came through the COC. It made it sound like it's new money every year for new beds. Disappointing to learn it's renewal, mostly renewal. So when we get 57 new beds, that's great. But when we looked at the prior number of datas in the prior presentation, we're not moving any needles very much or very fast. So I'm really curious to know, and I'd love to hear, specifically from Rachel and her experience, and how do we leverage? How do we get more leverage out of the dollars we're spending? I don't see those numbers, cost per unit, or how do we make this more of an efficient process? Not from a process part, but from an outcome. You know what I mean? That we have more numbers, limited dollars. We don't control them. Yeah, we go through we get them out, but how do we? There's so much. It just seems like our hands are handcuffed, and yet there's this ominous thing for us to be able to do, and we don't. Other than some of the strategic things we talk about, how do we persuade others to get involved? How do we move that needle across the whole continuum? And it's not just us, because we can only do what we can do, but I don't know. I just sharing that because I know I want to be involved in this. I want to see how these numbers actually work, how we can actually make a bigger dent in that and or compel others to be a party to it.
Thank you for that feedback, Chris. That's a double-edged sword, right? Is one of the really important things is that we're monitoring our programs, right? And making sure we're getting that we have efficiencies and that we have quality that, so that people are really ending their homelessness and we don't have returns to homelessness from our programs. So that's really important, and supporting our programs and being the very best they can be. And, some of them were funded 30 years ago, right? And we need to make sure that they're keeping up with the most current thinking and ways of operating. And then on the other side of that point is that keeping these, very well-oiled machines and beds in place is extremely important, right? Keeping the capacity that we have in our community is extremely important. If we don't, we'll fall even further behind. And then, 57 beds doesn't sound like a lot, but when they come through the continuum of care, it is, because that's permanent capacity now to our community. So now every year we have 57 more beds than we had before. So it is really important. And then I think the third thing you hit on is like, okay, so the continuum of care can't be the end all be all, right? There has to be all these other, people come into town to, address this issue. So how do we leverage what the continuum of care is doing and get everybody else involved? So very well taken comments. I think those are all really important things for the board to focus on. So thank you. I am hearing a sentiment that, one other question, Katie, when does the rank and review committee need to have this direction?
All based on when the Nofo comes out, which is a little bit of an unknown. So ideally, we would go with like rank and review would probably be meeting starting like middle of July. So if you all could provide that input by like middle to end of June, that would be like a great.
Okay. So I am personally feeling like we could wait and hearing some consensus for waiting till we're done with the strategic planning, given that we're so close and we think we'll be done in April. I know that we have 2 volunteers already, Rachel and Chris, and if anybody else is looking to participate in that, please let us know. That would be great. We won't even have to ask for volunteers. And we'll touch, I think maybe Katie, could we touch back on that at the next strategic planning meeting? Perfect. All right. Perfect. Thank you, everyone. All right, moving on. So you all might remember this little thing called the point in time count happened. And though that data has now been released. So I'd like to ask Katie to give us an overview of the results of the point in time count, but also to talk a little bit about the other types of data available in our system and how we should be using those data sources to support what we're telling the community every year, which could be a lot more in-depth than what we are doing currently with the point in time count. And ultimately, I think as a board, it is our responsibility and prerogative to determine what information we're giving out to the community and whether or not, what place the point in time count has in our annual dialogue and how we're presenting, or do we have better stuff to present now, or do we want to use some of the data points along with it? Because the way we're doing it now is a decision point that the board made at one time based on the data they have. And now we really have so much better data. And so we really want to get into a discussion, whether here or in strategic planning, about the place that we are having the point in time hold in our current narrative in our community, and whether we want to modify that at all. So with that, I'm going to turn it over to Katie.
Thank you, Ryan. So as Ryan said, this is really a conversation. I'm going to give you a presentation, but we really don't want it to be presentation based. So to give you context, we have quite a bit of data available in our system besides just point in time count. So kind of just to run through those, we have the point in time count and the housing inventory count, which happens once a year in January. It's the last 10 days of January. We also have our system flow synthesis, which is produced on a quarterly report, really synthesizing down what's happening on the system flow dashboard, which is updated on a monthly basis, really focused on the COC providers and kind of the work that they are doing. And then finally, we do have a housing inventory count that happens on a monthly basis, understanding what is happening in both our sheltered and also our PSH rapid housing programs, all of those things. So I'm really going to tell you what is it, and then what are the pros and cons or benefits and limitations of each of these. I'm sure this may just be some information you already know, but want to get out in front of you. So point in time count and housing inventory count, it's an annual street and sheltered count. We measure both what is happening on the outside and on the outside, meaning on the street, and then also within shelters. It is a requirement by HUD to do on at least a biannual basis, meaning every other year. This year we had over 500 volunteers across 23 cities and towns, and we went completely paperless. So it was an all app-based survey and had volunteers download it on their phones. This is all of the touch points from the 2022 point in time count. As you can see, covers the entire region, every area, and at each point was where we found somebody who was unsheltered. This year's unsheltered count was 5,029. The sheltered count has yet to be released, but should be in the next month or so. Benefits and limitations. So the benefits is because it is a required HUD count, it does help bring those COC dollars into our communities. One of the factors within our notice of funding opportunity each year is whether or not we did the point in time count and how does it compare to previous years. It provides useful data for planning purposes, so cities can see what are their trends, what is happening. Oh, that's my next point. It analyzes trends of homelessness. So we see over time across cities, are we increasing, are we decreasing, what is happening there? Some limitations to the count is it's really difficult to measure family and youth homelessness. So we're not necessarily seeing all those different subpopulations because they often don't hit in on the morning of the count. Data is all self-reported. So we do ask a number of questions, things like substance use, mental health, what's keeping you from having a job? Are you fleeing domestic violence? But everything in that is self-reported and based off of you opening up to the volunteer as an individual. And finally, it does not give a full picture of homelessness. So we know that we're spending about 10 minutes, we're kind of interacting, and it's mostly volunteer driven, and we're not able to really see kind of everything that is happening just on that morning of the count. Want to move forward to your system flow synthesis and dashboard. So the dashboard is created on a monthly basis. Your system flow synthesis is a quarterly report of that dashboard. And it has additional narrative really driven by the COC community. It is a reflection of Homeless Management Information System, or HMIS data. It includes active, inflow, and outflow. So all of those numbers in your active are based on how many people are coming into your system and how many people are going out based off of how the COC has decided to measure your active number. Some benefits and limitations. So the benefits is it reflects the current data available on a month-to-month basis. So it's not just once a year. It includes both subpopulations and unsheltered. So we have elderly, youth, chronic population. We also just added race data, so both BIPOC and white. And then it provides whether or not somebody is unsheltered or not in our active number. It does provide contextual data. We have a rolling 3 years basis on it, but we do have data back to 2018. Limitations is based on the data that is recorded in HMIS. So if folks are never touched by an outreach provider and somebody who is in HMIS, this would not capture it. It's not broken down by the city, but it can be. So right now we don't break it down into what city folks have last interacted in, but we can do that. So lastly, we have the housing inventory count. This is something that our HMIS team runs on a monthly basis. It's again a reflection of the HMIS system, but it is just a reflection of that same data that we capture in January, except on a month-to-month basis all the way through December. So similar benefits to the housing inventory count, although it does reflect the current data available on a month-to-month basis. It includes your subpopulations in housing, so it does break down like families versus veterans versus youth and what program they're in, provides that contextual data throughout the year. This report, however, does not include agencies that do not report into HMIS. So some of those agencies that we really work tooth and nail to get in January, we don't spend that energy throughout the rest of the year to collect that data on a monthly basis, and it only reflects the sheltered population. So this is only going to be folks in emergency shelter, transitional housing, or safe haven, a rapid rehousing, or a permanent supportive housing program in HMIS. Again, I'm here to answer any questions. I know that was a lot, so if you want me to go back or if you want to talk through anything, happy to answer any questions.
Great, thanks, Katie. Let's start with questions from the board.
I have one question. Is it frowned upon at all by HUD to do a biannual count instead of an annual count?
I don't know if frowned upon is the right, they only require an every other year count. As we've seen, like our count like double. So we saw a 36% increase instead of an 18% per year. There are some communities who are really trying to go away from the point in time count, saying that it's not a best practice. And HUD has not given them not to go ahead. They are just still require like an every other year count to show the national data. They essentially just use your trend data on the year that you don't do the counts.
But Katie, the point in time count, at least every other year, is required by HUD. There's no question about that. So now it's just, do we want to do every other year, and then in between that, use the other data? Is that what's on the table?
I don't know if on the table of really eliminating an every other year count has been asked. Like that is up to you as a board to decide what you all want to do. I will say that when we didn't do a count in 2021, there were still local cities who chose to do a count anyway. We received a waiver because of COVID and decided not to do a system-wide count. That being said, I will say there are some communities who still had a COVID like spur in January and decided not to use the waiver to do the count in February and just not do the count at all. And we've yet to see kind of how HUD has responded to that. Specifically, Seattle and King County is looking to use something like a system flow dashboard to show what is happening on a month-to-month basis rather than using the point in time count. And HUD is working with them on a pilot project, but we don't know where that's landed at this point.
I don't think at this point, Tad, anyone's suggesting that we would not comply with the Nofo requirements, with HUD's requirements, but that is one decision point is, do we want to do this every year? Would we like to reduce to every other year just to meet the requirement? But I think more broadly, the question is, we have more robust data now. We have much more complex data than a simple point in time. The point in time is one way to look at data, and it does have a purpose. And, one of those things is, like Katie said, not everybody's in HMIS. So, that's an important piece. I think a lot of the discussion that I've been hearing out in the community since we released the numbers is more so about the level of emphasis that we place on the point in time count. And really using that moment, what we do now is we use that moment in time in our community to say, this is what it is. And it's almost all everyone can see, because that's how we've educated our community in the past, right? Once a year, we do this thing, everybody knows what it is, they know when it's coming. But now we have such better data. So what space are we allowing this one point of data to hold in our community dialogue? And are there better ways to do that? Or are there additional ways to do that? Do we want to have a different narrative and use this one piece of data differently? I don't suggest that we buck the HUD requirement. I don't think there's any reason to do that. They require it, and I think that that's important. But we should certainly watch the discussions that are going on in other communities so that we know every option that's available to us. And, there are there are pros and cons to everything. For instance, right, like we really want to know what's going on in our community, but right now, HUD, we get a better score if the numbers go down, and our numbers are going up. So, our more robust, complex data might show that as well. So there's really a lot of variables about how we use our data, but I think we're just talking about wanting to provide the community a more informed picture than this one piece of data that we use, and we don't really use anything else right now. So I think it's just part of this larger discussion about data. So I'm interested in hearing if any board members or audience members have any thoughts about this, or if it's something we should tackle in strategic planning or what.
This is
Hi,
Liz.
this is Jacqueline. Oh.
Go ahead, Jacqueline.
Go ahead. Okay, thank you. I was just wondering about the history of recent trends from the past, and if there's any data that shows any initiatives that came about from those particular trends that were identified from previous surveys or.
Trends? You mean, did the surveys, did the data lead us to move in a certain direction in terms of programming types and stuff like that?
Yes. What was the discovery from the information from previous years, and like if what came about from that information?
Katie, you want to tackle that?
I just don't know what the direction.
Yeah.
Sorry.
It's a complex answer. Yeah.
Yeah, I would say that, so to answer your trends question, we have seen a continued increase, especially among our unsheltered population since 2014. I can go ahead and share, this is like the trend without 2022 data. We again saw kind of that continued increase going up with our 2022 data showing 5,029. If we had done a 2021 count, so we've seen like essentially from 2019 to 2020, there was an 18% increase in unsheltered. We're continuing to see that. We saw a 35% increase from 2020 to 2022. If you split that in half, we would have seen that 18-ish, 17.5% increase in 2021, and then another 17.5% in 2022. I'm hoping that will answer your question.
Yes, a little bit. Like with that information, are there any initiatives or programs that were specifically either designed or targeted based?
So one example, Jacqueline, might be, for instance, we continue to see a rise in unsheltered homelessness, right? And I want to say 2 years ago now, when we last had the data, it was the first time that we had seen our unsheltered population be above our sheltered population in Maricopa County. And so some of the things that are coming out of that are, for instance, non-congregate shelter as an option versus congregate shelter, because we know that people who have many, many barriers would do better or can access better non-congregate shelter than congregate shelter. So yes, of course we look at the data and it informs how we want to spend our money and what models that we're looking at over time. But I think as a community of providers, we're looking at this data constantly and making these decisions and choices constantly. It's kind of an iterative process throughout the year. And we just choose to, we do this particular data assessment once a year, and then we really highly publicize it. And then there's lots of attention in the public around this one piece of data that's driving decision making. And there's a lot more data that we could be using to tell the story. So that's sort of the discussion I'm interested in hearing from the board is, where do we want to continue to have the PIT count be our primary data source, or do we want to try to, supplement it with some other data, and how might we go about that going, in the future? And I think we're having these discussions in our strategic planning as we're talking about this new framework that we're looking at that's using our system performance measures and rallying, on the quarterly report that we're doing now, and taking all the data from the system and what we're going to do with it and how we're going to use that in public. And we're talking about that in our communication plan. So I think these conversations are very much enmeshed in everything we're doing in our strategic planning and everything that's happening right now. I just wanted to point out, now that we have our PIT data, that it's probably time this year, even though we have all this additional data, it was still a big press, a big release of information when this data came out. And I think we need to this year be looking at how we're going to be prepared for next year, how we're going to use that piece of data, and what other pieces of data and work and public education are we going to have done prior to that, so that when that piece of data comes out, it fits into everybody's knowledge and learning, and they know what it means, and we're ready to talk about what we're doing about it. I think it's just a good time to bring up this discussion, and something we really need to keep at the forefront of our planning in terms of how we educate the community.
Chris, you asked in the chat, where can we find these reports? What reports specifically are you looking for?
All the ones in that PowerPoint you just had out there.
So your point in time count data has actually not been released for 2022. We only have the press release that went out, and then your system flow dashboard has been added to, it's part of your board, and I can also show my screen.
Madam Chair, this is Jackie. So I think for many years we have been frustrated with the fact that just the pure point in time data doesn't tell the whole story. And I think that, we do have some really robust data at our fingertips. And I think it's a great opportunity, as a public, when you look at an 18% increase year over year, it's an alarming statistic. But to fold in some of the positive wins that have happened, that have been implemented to address the issue of the increase, I think is really critical. Number one, to educate the public but also to keep the public engaged, because I think the worst thing that can happen is that our public becomes so desensitized, and we've got to keep that hope going and that drive for positive outcomes in the future. That's where I'm coming from.
Thank you, Jackie. I think one of the other fears is people saying, you're putting all this money into homelessness, but yet it continues to increase. What's happening? And I think what so many of us know is we're putting money into the back end, into services, but we know that more emphasis needs to be put on the front end into housing and wages and systems of care. So how do we use our data to tell our story in that way so that we're telling a proactive story and not a reactionary story? So that is, I don't expect us to solve this dilemma today, but I just wanted to throw out there for everyone to start thinking about. This is what our PIT data looks like. We have all this other data. None of it is in our favor at this moment. What is in our favor is our strong community and our strong will to influence this issue in the right direction. And I want to start talking about how we tell that story and engage others to help us. So if you would all just think about that as we move forward, I think maybe we can talk about it in one of our next strategic planning sessions, Katie. And if members of the audience, members of our community have thoughts about this, I would love to hear them. Please send them into MAG if you would, and they can share them with us at our next strategic planning as we kind of move forward on this.
Co-Chair Balch, Amy Schauenlander is with us from the audience and has her hand raised.
Fantastic. Hello, Amy. Where are you?
There we go. Perfect.
Hello.
Thank you. Thanks for letting me speak. I think this is really important conversation, and without deciding whether or not to do the point in time count annually or every other year, I think having a common message is super critical, because what happens is, as providers, we each have access to our own data and we create stories and paint pictures. And that's not the story of the whole continuum of care in the entire region. And I know there's lots of other dashboards, and there's the systems view and the inflow outflow. I think when the question got to where are these things accessible and saved, I don't know that we have a summary that's a narrative that is blasted out, and whether that's monthly or quarterly, but someone who could actually look at all those dashboards and measurements that can be tracked at the system level, and writing that narrative so that as service providers and influencers, stakeholders, decision makers, funders, we all are looking at the same narrative, rather than each of us doing the direct service, coming up with our own narrative. We will always be competing with each other, or be perceived that we're competing with each other, if we are left to write our own story of the data that we have. So I would support any effort to tie everything together, tell one story, to use this continuum of care as the place where the data conversation happens, that everyone can agree by using the data. What are the trends? Is one subpopulation really growing in homelessness faster than another subpopulation? When people ask me that, I say, I don't know. How could I know which subpopulation is growing faster? Because I don't see the total story for our region. So, and I'm happy to talk more, or be, part of conversations or a work group, whatever happens, to continue the important conversation. Thank you.
Thank you so much, Amy. Appreciate those comments and appreciate your willingness to join us in speaking today, and encourage everybody to do that, please. Virtual forums have their pluses and minuses, but I think one of the real deficits that we have in this virtual time is not being with our audience. So I really want to get back to a place where we are hearing from our audience. So, and by audience, I mean our community. All right, any other thoughts on that? it would be great if once we decide this, and I think this is really part of our communication plan piece too. If I don't recall, there's a piece of our communication plan that talks about how we want to share data and stories. But I just love that idea of having one story for the whole community that all providers can use as well. But it's got to be useful to every provider too. So this will be a really in-depth kind of conversation, I think. And, then there's, funders need this information, jurisdictions need this information. It would be great if we could all get on a page together. And then, we have all these wonderful websites now that MAG does. We can ask that they be updated monthly, that we have infographics. I mean, once we decide on how our story should be shared, I think we can ask for those kinds of things. So thank you, everyone. If there's nothing else on this, I will move on to the next item. Don't see anything.
Madam Chair, I don't know if you can hear me. Hey, it's Eric Cole. I'm
Oh,
sorry
hi, Eric.
to be late, but hi. I've been on and off, but related to those last couple of points and that great suggestion from Amy, I think our communications committee can take this up and add it to our work plan if it's not already there. So we're happy to address and invite anybody else to join us that wants to.
Thank you, Eric. And I know that we have community members versus just board members on that committee. So that would be great. Yes. I think I heard Amy volunteer.
We will make sure she's looped in.
Yeah. Okay. Thank you very much. Okay, let me see if I can find my place in this discussion. Okay, so we're at number 8, request for future agenda items. Do any board members have items they'd like to see on future agendas? Besides everything we keep talking about. All right. Hearing none, I'm going to move on. We are now at comments from the board. Are there any board members that have comments, announcements, events to announce, anything like that? Exciting happenings, new programs coming online?
This is Joan. I just want to say thanks to everybody for their participation and engagement at the Maricopa stand down. It was a successful event in the age of COVID, which is weird to host events. And so just a successful event. Thank you for that. And we look forward to seeing you at our conference.
Fantastic. Thank you, Joan. Do you guys have any outcomes from it yet? Or is it just too soon?
Well, we know we welcomed, we're verifying the status, but we believe we welcomed 695 veterans at the event.
Wow.
The one-day event.
Is that, how does that compare to previous years?
So in 2020, which we were able to have it, there was a little over 2,000 welcomed for that 2-day event.
Okay.
So I think it really had no idea what to expect. HSC was an amazing partner with us. And so I'm just appreciative to not only them, but so many of you guys on the phone making it happen.
Awesome. Thank you, Joan. Such a great event. And I heard Mr. Gruen was in town as well. So that's great. All right. Anyone else?
Yep. Hey, Ryan, this is Tad. A little bit of an exciting thing that we have with the City of Phoenix. A partnership was just announced recently where ARPA dollars that the city was awarded previously, which have been carved out for behavioral health services for uninsured and underinsured. So a partnership with Mercy Care has been solidified with the city to give residents of the City of Phoenix some much needed services for those that are uninsured and underinsured. And so Mercy Care will be managing those services and working very closely. And anyone that's interested in hearing more about these important services during this really challenging time for the whole community, given the pandemic, anyone that's interested in hearing more or how to access those services, please feel free to reach out to me, because we really, really, really need people to be aware that these services are available. So any messaging or questions or anything, please feel free to let me know.
That is a really awesome news, Tad. I know I will definitely take you up on that offer to learn more about that. That's so cool to see a city engaging in that way. That's just super fantastic.
Yes.
Thank you for sharing that with us. All right. Anybody else?
Madam Chair, I've got one thing.
Yes.
Maricopa County has been operating a COVID isolation hotel for people experiencing homelessness for the last 2 years. It is coming to a close in June, but we are hosting a town hall with public health and shelters, any congregate settings who want to kind of talk about the process of moving from pandemic to endemic and lessons learned, and how we can all adjust operations to shelter on site in the future. So that's April 14th. I haven't sent out the invitation yet, but it will be April 14th at 9:30 a.m. And that's open to any congregate setting, shelter, and we'll have our doctors from Maricopa County Public Health to help answer questions and hopefully get great information out there on how we can all do this together.
That's awesome, Rachel. Thank you so much. I know I'm going to encourage all the shelters that I engage with to participate in this important conversation. I know the transition is challenging, and I'm really grateful for the county that is, in the business of public health for providing this kind of guidance. So thank you so very much. Looking forward to that invitation for sure. Thank you. Chris? I don't know, you came on my screen. Do you have something? You showed up. No? Okay. Anybody else? All right. Well, with that, there is no further business. So this meeting is adjourned. Thanks so much, everybody, for attending. Have a great rest of your week.
Board members, look for another board strategic planning session in the.
All right. Thank you, Katie. If you didn't hear her, look for our next strategic planning invite. All right. Thanks so much, everyone.
Thank you.